Group model is different from other groups. First of all, it's larger, and we have more degrees of expertise in different areas of expertise, number one. Number two, the closest thing you might think would be an academic setting where a number of plastic surgeons are in the department or section of plastic surgery. But that is a very different paradigm. It's really kind of cutthroat. It's extremely competitive, and the people are competing with each other for who can bill the most. And it's kind of a backstabbing situation. There's some mutual respect, I'm sure, but the pressure is such that it's not really collegial in many situations. We are freed from that. We are not competing with each other. Each of us has enough business that we are focusing on our own patients and our own approaches to problem solving. We're not quibbling with each other. We're focusing on the patient, not on each other, looking over each other's shoulders. So to me, it's the ideal situation. We have economies of scale, exactly, so that we can have multiple lasers, we can have the latest equipment, we can have the latest training of anything. We can bring people, for example, Jeff brought one of the world experts in vaginal rejuvenation from California here, and he taught a course to 5 of us here about all different aspects of vaginal rejuvenation, vaginal tightening, labia reduction, bladder suspension for incontinence, and so forth. This was an intensive course here, and he's willing to bring us whatever kind of training or special equipment that we need to be state-of-the-art in delivering our services to our patients. We're always looking for new technology. LipoX is one of the latest things, and it's a radiofrequency treatment for cellulite and fat reduction. It even reduces visceral fat. That's the fat inside the abdomen that traditional liposuction cannot access. But other new techniques, not necessarily intensive, for example, the liquid facelift or stem cell facelift. That's something that Jeff will often see the new trends in plastic surgery coming before we will, and he will encourage us to try these new techniques. For example, harvesting fat cells with liposuction and spinning them down and taking the stem cell fraction. Stem cells, as you know, are the pluripotential cells that can develop into whatever type of cell they're placed within. So you can take these stem cells and put them to facial injections along the creases here, or to fill out cheekbones or other bony features, and they serve as transplanted living cells, as opposed to using artificial fillers which only have a finite half-life. And the same thing goes with buttock enhancement, and it's really a type of recycling where you take fat from areas where you don't want it and place it in areas where you do want it, as opposed to having the risks of buttock implants, for example. You can use your own tissue. So these are all cutting-edge stem cell type of things that are really on the crest of the wave, if you will.